Here we are. It is Friday, May the 5th, and this is the 51st webinar. I'm your moderator today, Yvonne Lewis. I'm so excited about where we are today in all of the 51 weeks that we have been able to come to you with information about the COVID vaccine, the COVID virus, and all of these related issues, and the partners that have come on at some time during these 51 weeks to be with us. We're looking forward. I just want to plant this in your minds. We're looking forward to next week, which will be week 52 and the 1-year anniversary of the declaration of the state of emergency for this pandemic in our nation. And so we're looking forward to that. We have an amazing program for you today. We're going to introduce a couple of new panelists today that'll be with us, and all of these folks have so much information to share. We'll be talking about vaccine updates, the 3 vaccines that have now been approved here in the United States, Moderna, Pfizer, Johnson & Johnson. We'll also be talking about cases trending up, which is something we want to be mindful of, and then the opportunity for healthcare enrollment and more. So we thank you for being here. So stay with us for what is coming up next. Today, we want to get started right off with ensuring that put those questions in the Q&A. I see somebody's already asking questions and already putting some information in. So put those questions in the Q&A so we can be sure to answer them for you as we move along today. I think you will have information that will cause you to ask some really great questions. Today, we want to get started though with Gary Jones. Gary Jones, of course, as you know, is out of the governor's office, and Gary is going to provide for us some really important updates out of the governor's office. Good afternoon, Gary.
Mm-hmm. Yeah, I get morning and afternoons confused often too.
Right? Feels like it's still morning. So much has already happened. But Gary, help us to understand what significant things have happened this week out of the governor's office.
Mm-hmm. Yeah, sure thing. So good afternoon, everyone. So starting Monday, March 8th, MDHHS is recommending guidance with the vaccination of Michiganders age 50 and older with medical conditions or disabilities, and caregiver family members and guardians who care for children with special healthcare needs. Beginning March 22nd, vaccine eligibility will again expand to include all Michiganders 50 and older. MDHHS also recently updated 2 of its epidemic orders, allowing for increased capacity limits at various venues, larger residential and non-residential gatherings, and expanded visitation opportunities at residential care facilities. Changes are designed to balance reopening while controlling the spread of COVID-19 and save Michiganders' lives. Although progress has been made in reduction of hospitalizations, it is crucial that Michiganders continue to mask up and socially distance as we reopen. The governor is continuing to urge passage of her My COVID Recovery Plan to fully allocate over $5 billion in federal funds passed by a bipartisan majority of Michigan's congressional delegation and signed by former President Trump to help the state increase testing, tracing, and lab capacity and ramp up the nation out of the pandemic and economic downturn stronger. There is also funding for schools, rental and utility assistance, as well as food assistance being held up by some legislators. So continue to reach out to legislative leaders for full allocation of these relief resources to local entities. With warmer temperatures being on the way, the Michigan Department of Insurance and Financial Services encourages Michiganders to take steps to be prepared for spring storms, flooding, and potential water damage before disaster strikes. Check the Department of Insurance and Financial Services website under Consumer News or email me for more information at jonesg9@michigan.gov. And lastly, Governor Whitmer and State Treasurer Rachel Eubanks announced the expansion of the My Classroom Heroes COVID-19 grants to include a new grant for Great Start Readiness Program, Head Start, Adult Education, and Young Adult Special Education Classroom Teacher. And lastly, to plug the 2 main websites, michigan.gov/COVID vaccine and michigan.gov/coronavirus, still the best catch-all websites for updates in the state of Michigan.
Thank you, Gary. And as always, you give great information. 2 things that you pointed out too, and we'll hear a little bit more about how community can get involved when we hear about our policy brief that's now being shared every week. But the other thing we talked about is what's so often asked of us, even in these last few hours. What about the younger people having an opportunity for vaccination? When is that going to shift? So we thank you for saying the governor has in a couple of weeks is going to open it up, but right in the next few days, it'll be opened up for those who are 50 and under. 50 and older who have underlying health conditions or are working with children with special needs or our guardians. And so we appreciate that information, Gary, because it leads us to a very important conversation that we're going to have next with Dr. Paul Kilgore. Dr. Paul Kilgore is one of our special guests today. He is an associate professor in the Department of Pharmacy at Wayne State University, and he wears a whole lot of hats. But one of the things that's important that we want to hear from Dr. Kilgore today is he's been involved in the Johnson & Johnson trials. You've heard us talk about Moderna and Pfizer, and we're going to have a little bit more information about that today. But the Johnson & Johnson vaccine has just been recently approved through the emergency use authorization. And so Dr. Kilgore, we're excited to have you here. Welcome you. Can you just please give us a little bit of background and then really give us insights on this Johnson & Johnson work that's been done?
Absolutely. Thank you very much, Yvonne. It's great to be here, and hi to everyone on the call today. So one of the things that I wanted to start out with, Yvonne, is really kind of addressing what seems to be an obvious question, but not necessarily, and that is COVID-19 really a serious disease that we need to prevent with a vaccine? And then right after that, I'm going to jump in and talk about vaccines and how they're safe and how we know that. And then I'm going to talk about what vaccine I would take and the vaccine recommendations that we have currently from CDC and that are being developed now. So, when we look back over a year to the pandemic start and we consider where we were, we had no idea that this disease would cause such death, disability, and just the awesome impact. One of the things that everyone knows, has seen on the news, is that these diseases actually cause very serious disease. They put people in the hospital, but not only that, they put people in a state where they have to be supported by a mechanical ventilator, like you see here in the upper right. That kind of picture, I can tell you firsthand, is something that no one wants to be part of if they can possibly help it. I will also tell you that one of the things that we know is happening to people who get even mild to moderate disease with COVID-19 and the virus is that they have persistent lung damage. This lung damage is basically a scarring of the tissue of your lung. And what that means is that your exercise tolerance goes down, you get short of breath, you get winded, even after you recover from the primary illness of COVID-19. So we compare it here in this picture to a smoker's lung, but the damage that this virus can do if you become infected is terrible. We want to prevent that, and that's the goal of the vaccines. Are the vaccines safe? I'm just going to start out right away and tell you that I know firsthand that the vaccines are safe. One of the reasons I know this is that I'm a co-principal investigator for the Moderna vaccine trial in Detroit, as well as the one-dose Johnson & Johnson vaccine trial in Detroit. We're conducting that at One Ford Place and K13 and Henford Hospital. We have data, and I'll show you in just a minute, that was presented at the FDA meeting last week. Literally last Friday, the FDA and the VRBPAC committee deliberated the safety and efficacy of this vaccine. I'm going to show you some of that information now. And the other thing to know is millions of people have received the Pfizer vaccine, Moderna vaccine, and now literally hundreds of thousands of people have received the Johnson & Johnson vaccine. It's the reason that's so is because it's a worldwide vaccine trial. These are folks from all walks of life, age 18 and over. These are a very diverse group, both ethnically and racially, and also includes both men and women. So based on the data from the trials, we see a adverse event profile, a safety profile that is very, very similar to the other vaccines, namely Pfizer and Moderna. The other thing I wanted to make sure everyone knows is that back 20, 30 years ago, we actually ran vaccine trials using paper, literally paper in triplicate or duplicate copy. We don't do that anymore because we have the benefit of computers, and the computers that we use now capture the vast majority of information. When you come into our clinic to be enrolled in a trial, we actually enter that information directly into the computer in real time, and it's saved in the cloud very securely so that no one can access it except the trial investigators and our staff. The other thing to know when we do trials, I'm going to go to the next slide now, because you can see in the top the traditional development timeline of a vaccine. So we did all the preclinical work you see here on the left-hand side, and then we submit the new drug approval. This is the FDA application to use it in humans. And then we do step-by-step phase 1, analyze the data, think about it a little bit, and then go on to phase 2, write a new protocol, analyze the data, and then submit to the FDA. The FDA reviews these, and then if all looks good after many months, the FDA will say, okay, you can go ahead and do phase 3. And then the biologics license application for getting an FDA license is submitted, and that review takes anywhere from 1 to 2 years in the past decades. That leads then to production of the vaccine you see here on the right. In our world today, with the benefit of computers, even smartphone apps, we can collect information in the trial from our participants in real time. And what that means is that when you have computerized data, it can be cleaned very quickly using programs, and then it can be analyzed very quickly. So you see in the lower graphic here that we actually prepared in the early part of the pandemic, back in February, March, they were already writing vaccine trial protocols. Those are the procedures and steps taken to enroll people and test the vaccine. In the laboratory, the work in the laboratory actually started January, February. So this was very, very early on. As soon as we heard about this new virus, the work was started in Germany with BioNTech, and then Pfizer picked up with that research, and then Moderna started as well early on in the pandemic. At the same time, they had the protocols written and prepared by separate teams. And one thing I can tell you is that the number of people working to develop these vaccines is not just 10, 20, or 30. It's literally in the thousands of numbers. We have thousands of scientists and researchers working to develop all these vaccines. It's a monumental effort. It wouldn't have been possible if BARDA, the Biomedical Advanced Research Development Agency of the HHS US government, had not put in the money. They put in billions of dollars literally to support all of the staff and the clinical trial development. So it's a combination of factors. Money, of course, was important, a big amount of money, electronic data collection, efficiency in developing the protocols, efficiency in the laboratory, and of course, the new technology for the vaccines. That all led to much, much quicker development. It was not rushed, and it was not done haphazardly. It was done very, very carefully. And I can attest to that because of the way that the clinical trial supervisors looked at all the data we collected. They check literally every number, every letter of all the information that's collected, and they triple check it. So I feel very confident of the results. The type of vaccine that we have with the J&J is really what I show here in number 3. It's a viral vector vaccine. It's a adenovirus, non-replicating. In other words, it doesn't make copies. It's not a live virus at all. And it can never cause disease in people. I mean, never, because it cannot make copies of itself. Impossible, literally. That's number 3. That's the Johnson & Johnson vaccine. Pfizer is under number 1. The Pfizer and Moderna are both mRNA vaccines. As you know, I won't talk much about that, although I have tons of slides to show you if you wanted. And then number 2, the recombinant vaccine, I won't talk about. That's the example of Novavax vaccine. Another great vaccine, I think, to look forward to in the future. The other thing I wanted to mention is that Johnson & Johnson is a 1-dose vaccine right now, a major advantage over having to get 2 doses. And getting 2 doses is feasible in many places, but for some people, getting 1 dose is really the way to go because they're working, they're busy. It's hard to come back into a clinic when you are working full time or even working 2 or 3 jobs. So all of these vaccines themselves underwent very careful laboratory testing in laboratory animals and humans, of course, but they went through the careful phase 1, 2, and 3 trials, step by step, at each step checking safety, number 1. And number 2, one thing to know is that these vaccines have been evaluated in US populations, very diverse populations indeed, including African American, Hispanic, Asian Americans, Native Americans, Arab Americans, all participating in these trials. And Detroit has been a premier site for Moderna and Johnson & Johnson, namely because we've been able to enroll a very diverse participant audience. So we've been very, very fortunate. the vaccines have been very well received in the Detroit area, Metro Detroit. We've even had participants come in as far as Jackson. So we've been very lucky. Let me go right back now to the J&J vaccine. The name of it in our protocol is the AD26, stands for adenovirus type 26, and it's CoV-2 for coronavirus 2 virus, and this is S stands for the spike protein. The only thing that the J&J vaccine will do is help you make spike protein. Literally, that's the only thing it will do. It will not actually insert into DNA, and I'll talk about that later as well. It does not do that. It does not change your DNA at all. It's a single small volume in your shoulder, and then you wait. Literally within a week or two, you start to be able to make antibody to the spike protein, and that's what will save lives, protect people, keep people out of the hospital, keep people out of the ICU. Overall, 85% efficacy in the United States, preventing COVID-19 hospitalizations and death. 72% overall efficacy. That just means that for even mild disease, it prevents illness. And that's a good thing because, even if you get mild COVID-19, that means you're going to be transmitting the virus potentially to other people. We don't want that. No one wants to be doing that. Plus, you often have to stay home from work or even isolate at home. That will save people money and time and the headache of having to go in and get treated even. The other thing I wanted to mention is that when we look at the approval, the vote that took place last week was, in my view, amazing because it was 100% of the committee, the VRBAC committee at the FDA, voted in favor of this vaccine. The vote was 22-0, I believe. Huge, huge support. And then the very next day, almost on the weekend, ACIP committee, actually it was Sunday morning and Sunday, the ACIP committee reviewed all the data from the Johnson & Johnson trials, and they recommended including the J&J vaccine as part of our armamentarium against coronavirus and COVID-19. So it has the stamp of approval from the ACIP committee, and these people are tough. The VRBAC committee, I know people on the VRBAC committee. Arnold Monto, you may know, is a professor at U of M. He was one of my professors, supervisors, teachers, mentors. He's tough, very, very tough looking at data. He will call people on the carpet if there's anything wrong with the clinical trials. I know that for a fact. So I have a lot of confidence in the committee decisions as well, both at FDA and CDC. This is a slide that I pulled directly from the VRBAC committee meeting at the FDA. You can see here on the right-hand side, after people in the trial had been followed for almost a month, day 28, it showed that the vaccine was 85% effective against disease, severe critical COVID-19. Even after 2 weeks, the vaccine showed some protection, which is amazing. It means that the antibodies you're making begin as early as 2 weeks. The other thing I wanted to point out is that they broke down the analysis by age, comorbidities, gender, race, ethnicity. And one of the things you can see here, right when I'm showing here, is that the vaccine efficacy was very similar in all of these subgroups. We call this subgroup analysis. You can see here the vaccine efficacy was very, very similar. And one of the things that it really highlights for me is that no matter what age, no matter what sex you are, no matter what racial ethnic group, this vaccine works and it does protect people. The other thing I want to point out with this vaccine is that we did monitor for local and systemic signs. The most prominent thing that you will experience when you get this vaccine is some discomfort at the injection site. Generally goes away after 2 to 3 days, 48 to 72 hours. That's great. There's few people that develop redness and swelling. That was relatively unusual. And you can see here the pain was the most prominent symptom. Systemically, people noticed they were a little bit tired, fatigued. They developed some headache. Some people did develop muscle aches, and even some people developed nausea and fever. That was much less. So fatigue, headache, and muscle aches were the most common things. But that didn't occur in everyone. You can see it occurred in about 40% of people, and most of them were relatively low grade or mild. So the J&J vaccine really gives you the ability to make the spike protein. This is a key for your formation of that protective antibody, the IgG neutralizing antibody, and your immunity. The J&J vaccine itself cannot cause disease. And I will underline that and repeat it many times. It does not change your cell's DNA. It manufactures a spike protein separate from your cellular DNA. The safety profile of J&J looks almost identical, actually, to the other vaccines you know about already, Pfizer and Moderna, namely discomfort at the injection site, some tiredness or fatigue, headache, and muscle aches, like I just said. So any of these three vaccines, the Johnson & Johnson, Moderna, and Pfizer, are safe and will provide strong protection against COVID-19. All three vaccines have been approved under the EUA emergency use authorization for the US, and these have been used in hundreds of thousands of diverse individuals, shown to be safe and effective in these individuals. Personally, and for my family, my father, my sister, brother, anyone, I would be very, very comfortable having them receive any one of these vaccines in the United States. And I say the same thing, literally, to my friends, family, coworkers. Any of these vaccines would be wonderful to have. We have real world evidence now on the safety and effectiveness of these vaccines. In Pfizer, we actually have demonstration in Israel that the vaccine is extremely safe and very effective in a real world situation. I expect to see more of that data from Moderna and the Johnson & Johnson vaccines coming out in the next several weeks. So I'd be happy to answer any questions, and thank you so much for your time.
Thank you so much, Dr. Kilgore. I know you have tons more to share, and we'll have to have you back sometime. But now you've raised some questions that I know many of us want to have answered. And we have a representative from actually Genesis on with us today, Mark Gutierrez, who is the director of pharmacy and pharmacy support services, and we want to welcome him today. And we're going to ask now our team. We've got a group, if you saw earlier we're going to go to our round table now, and we're going to ask them all to unmute themselves and turn on their cameras so we can see them. That's Dr. Wolford, Dr. Verholden. We're going to ask you to stay with us, Dr. Kilgore, and Dr. Larry Reynolds is also going to join us for this conversation. So I want to just queue up. We've got a couple of questions that start right off for you, Dr. Kilgore, since you talked about this so strongly. Question is, if the how many vaccines have Johnson & Johnson produced before this vaccination particularly?
That's a great question. One of the things to know is that actually Johnson & Johnson acquired a company from the Netherlands called Janssen. That's why it's spelled Janssen. Janssen is the company that actually was the vaccine manufacturer. They were the ones behind the science for this vaccine. One of the things that they did actually several years ago is they developed a platform technology, the AD26 platform technology. This is a vector. It's basically a vehicle to introduce a protein into cells to make antibody. And they first actually did it with the Ebola vaccines. The Ebola vaccine that they made several years ago has been approved. It's being used still. It is a very effective vaccine, very safe. And all they had to do for the new vaccine for COVID-19 is change out a gene to make the spike protein. So the technology itself is proven. They have a platform. That's why they could actually ramp up production. And so you see this week, they're distributing vaccine.
Thank you. Now, Mark, you're with us from Ascension Genesis, and I know you're a pharmacist there. Can you tell us kind of what's happening at Ascension and where are you in helping with the vaccine distribution?
Yeah, great. I'm glad to. A lot of good things. I guess I want to begin with Dr. Kilgore and Dr. Reynolds and tell them that I also am a proud graduate of that great university in Wayne County that both of you referred to. Go Wayne State. So a lot of good things out. You know, the availability of the vaccine is getting better and better every week. We're still not where we need to be, but it's getting better and better. You know, when we began in January, we received the next vaccine to vaccinate all the healthcare employees, all the first responders and so forth. Now for the several weeks, we're running a couple different clinics for people in the community. As you know, right now we're vaccinating anybody 65 and older. And next week, we're going to expand that, which is great for 50 and older. kind of glad to report, just like Dr. Kilgore reports, we're vaccinating literally thousands of people every week. And we're not having any issues with it. I don't know of anybody that's had any problem. Most everybody I talk to tells me they have a little soreness in their arm from the injection. That's pretty common. We're glad to be getting the vaccine out to all of our community members.
So thank you for that. I know, Dr. Wolford, you talked about these differences in vaccines over time. What insights, based upon the conversation from Dr. Kilgore, would you like us to know today?
Well, I think that it's really important and has been emphasized that all of these vaccines work very well. And so whichever one you can get, you should get. But you know, I like my fruit basket. And before I go to the fruit basket, I'll say we've been talking about the messenger RNA vaccines, right? So we've been talking about vaccines, the Pfizer and the Moderna one. And if you think about it like my little Hershey Kiss here, that it's a little ball of fat, which Aunt Hershey's Kiss is just a ball of fat. It's a little ball of fat. And inside it are the instructions, you know, the little tag here. These are the instructions for how to make that spike protein. And that's how those vaccines help us to learn how to fight that spike protein or the virus with the spike protein on it when we actually come in contact with it. With the Johnson & Johnson vaccine, what, as I think was mentioned, in this case, we go to my fruit basket, like another virus. If we think about this as the adenovirus, and this adenovirus has been, everything that makes it a virus has been taken out from the inside, so it cannot reproduce itself. But on the inside, instead of seeing what you would expect to see, you get the genetic material to make the spike protein. So here we have.
Well, Dr. Wolford, can you help us to see that really big? Is that the seed?
This is a seed from a peach. So this is the seed, this is the genetic material for another thing. This is the genetic material that will make the spike protein, not the adenovirus that got it in there. This is just the way it gets into the cell, but everything that makes it an adenovirus, most of what makes it an adenovirus, is taken out and replaced by the genetic material that would make the spike. And that's how it teaches our body how to fight against that spike protein when we come in contact with it.
Thank you so much. And we've got so many questions in queue. I always come up with these cute little examples, Dr. Wolford. We have so many questions in the queue, and I want our listeners to know, and those who are in the webinar today, that our panelists will be answering some of these questions, and we'll work to get to them. Dr. Reynolds, you're always giving us the 411 on this. So we've got Moderna, we've got Johnson & Johnson, and we've got Pfizer. How should we respond as community?
All right, I'll start off with the end. Get whatever vaccine you can get as soon as you can get it. Number one. Number two, the vaccines can prevent death, can prevent hospitalization, can prevent severe disease. And so it's difficult to compare the vaccines head to head in the real world, but that's a great step forward, because as Dr. Kilgore said earlier, you don't want to have to be in the hospital, you don't want to be bed bound, nor do you want to have to deal with the conditions that follow a serious COVID-19 disease episode. So that's the key take-home message. Get what you can when you can. Now, I'll get personal. In my family, one of us I got the Moderna vaccine. My mother got the Pfizer vaccine, and my sister and brother-in-law and all my nieces and nephews who work in a hospital got different vaccines. The key is there is some overlap in the side effects. But those will pass within a day, and for a day or two. For allergic reactions, that's why they have you sit there for 15 minutes before you leave, so that they can monitor you and direct you for further care if it is needed. And on rare occasions, it does happen. So that's why we have to be attentive to the instructions that are given when we go for vaccination. And that's why we should stay in contact with our provider or the health department so we can discuss these things. And I saw a question about what do we do about side effects, and someone may have talked about adverse reactions. If you go to cdc.gov, there's the adverse reaction event reporting site where you can report, you or the person who vaccinated you can report things. So we're really being very serious on tracking what can happen. And like I say, other than those side effects where, and I did have to take Tylenol after the first 24 to 36 hours for fever and chills, but within 36 hours, I was a little fatigued and then back to normal. And I should add all that information. I am a senior citizen. So I don't know what it's like for the young folks.
Thank you, Dr. Reynolds. I want to just go back quickly, and we are moving along with our time here. But Mark, there's some appreciation for what Genesis is doing in terms of getting the patients enrolled. And I know you've talked about some future opportunities. So the question is there a list or somewhere for Genesis folks? What are the plans at Genesis regarding a larger community effort?
Right. So right now, one of our primary goals is to get the vaccine out as fast as possible. And the fastest way to do that is currently we're working through our physician offices. We literally have hundreds of thousands of people that are associated with those offices. And those physicians in the Ascension practices are scheduling all of their patients to be vaccinated. Sometime in the near future, we're working to have more of a public website or a public phone number that anybody could call. We don't have that developed yet. We didn't want to wait for the technology to be built to start the vaccinations. So right now we're just vaccinating, anybody that comes our way, and they're coming our way primarily through the physicians in our community. And any of the physicians can do that. I'd like to make a mention, we talked a lot about the Johnson & Johnson vaccine. This is a great opportunity for us. We see so many people that come through our hospital and they need to get the vaccine. And it's very problematic with a 2-dose vaccine because we don't know how we can give them the second dose. We couldn't guarantee that. And now that we're going to get this first dose vaccine, we are just really excited. When they come to our facility, they meet the criteria, we'll be able to give them. And very soon we're going to be able to do that.
Thank you, Mark. And I know we're going to have to revisit this conversation at another time, but I appreciate all of those of you. And I've kind of saved Dr. Deborah for last because she's our resident epidemiologist, and I know she's got some perspectives on this that we want to hear. And then we're going to segue into the policy brief. So Dr. Deb, how do you round out this part of our roundtable from your perspective?
Well, I really appreciate my colleagues coming on and sort of, and thank you so much, Dr. Kilgore. It makes us all feel really good to know we've got one of our own who was at the table and can give us really trusted, credible messaging about what these vaccines are and are not. The thing that overwhelms me is people are very concerned and they ask really good questions because during this pandemic, we all have a heightened sense of awareness. People had never heard of mRNA outside of maybe chemistry class in high school as a fleeting thought or things like that. So now we've got more questions than we've got answers. So I really appreciate our colleagues giving us the answers. And a lot of what we're seeing around how vaccines are developed and what they do and don't do is not new. It just so happens that we got vaccines injected in our arms before this, not in a pandemic and not asking all these questions. So I'm excited that people are asking questions and want to increase their knowledge because knowledge is power. What I don't want to have happen is people get just enough knowledge to fall in the information gaps between the goalposts of knowledge that they do have and then ultimately make decisions that don't protect them. So I'll just say as an epidemiologist, these vaccines are one very important, albeit imperfect, layer of protection. for us in combating this pandemic and turning the tides. I agree with Dr. Reynolds. Get the vaccine that's offered to you when it's available, because ultimately it is going to serve you, and it's going to serve your family, and it's going to serve your community. And we've all heard about this concept of herd immunity. I want to be really clear for people. Herd immunity is not about people getting sick, some people dying, people developing some kind of natural immunity, and then us moving on. Herd immunity is a critical public health concept, and it is about prevention. It is about preventing people from getting sick in the first place. And the vaccine is one of our best tools that we have right now, besides the basic protocols of wearing your mask, washing your hands, and watching your distance to other people to help us keep people protected and prevent people from getting severely ill, and also reduce the likelihood that if they were exposed, they could spread it to somebody else. So I really appreciate my colleagues for doing that. Your public health message is the vaccine, imperfect but important in the multiple layers that we're going to implement to improve our success to combat this pandemic.
Thank you, Dr. Devers. You round out this panel today with Dr. Paul Kilgore from Wayne State University, Dr. Susan Wolfer from Michigan State University of Michigan, excuse me, and Mark, forgive me, Gazzato from Ascension Genesis, along with our Chief Health Advisor, Dr. Reynolds, and Dr. Deborah for holding. Thank you all. And we're going to just take a shift, but as we're taking that shift to look at our policy brief, I want to remind those of you that are putting your questions in the queue, our panelists are going to answer, and we're answering those questions right openly for everybody to see, because we won't be able to answer them all as an individual questions today, but please check the Q&A so you can see the answers that are coming forward. And for those of you that are not available, we're going to continue to work to try to make sure we get this credible information to you. Dr. Deborah Verholden, you were that last speaker on the panel. Would you please now help us to understand what's happening with the policies and the trends that we're seeing as a result of the data that you're being able to collect?
Great. We have a really fantastic data dashboard. Took us a little while to get it set up, but it's set up. And this data dashboard can be used by local health providers, service agencies, by city officials, by policymakers. Please check out the website, gchd.us/coronavirus. When you get your health policy brief, I'm just giving you a snapshot of what it looks like. There's that cool purple button in the middle, current trends, March 5th, 2021. Those are the trends up to that day. You click on that button in the brief, it takes you right to the data dashboard. What I want to let people know is that our cases are increasing both in Flint and in Genesee County. This is not a huge surprise. It's not what we wanted to see, but we started reopening on February 1st. Automatic, when you increase the likelihood of people coming in contact with one another, you might see an uptick in cases. Why? Because we're talking about something that spreads through droplets, person-to-person interaction, and being in proximity to people. So as we increase the amount of interactions that people have, we will create additional opportunities for people to come in contact. We had done really well, and that community case rate had gotten down below 3%. Over the last 3 weeks, it has ticked up. Our community case rate is now at 5.6%. What a community case rate is of the people who are getting tested, more people are coming back positive than they were in the weeks that followed. That's a 1.3 increase from last week. It might seem trivial, but imagine if we stayed that course, in a few weeks, we'd be well over 10%. That's not our goal. So there's a great little analogy that I love from one of the Dalai Lamas, and someone asked him, what did you do before enlightenment? And he said, I scrubbed floors and washed dishes. And they said, what'd you do after enlightenment? And he said, I scrubbed floors and washed dishes. So what I want to tell people is, what do you do before you get your vaccine? You wear your mask, you wash your hands, you watch your distance. What do you do after you get your vaccine? You wear your mask, you wash your hands, you watch your distance. Even though we've got more interaction, that the protocols still hold. And as we figure out what the new normal looks like, I know we can do that work. But I want to make sure that people are clear the rates are going up. So it's more important than ever, especially if you're out and interacting with others, or you're interacting with people who are out, that you honor the protocols. All right, what does that look like? Basic snapshot. Here's the bar graphs. The rates are going up a little bit. Not a whole lot, but again, it's a trend. Notice 3 weeks of things inching up. Still dealing with this issue around unknown race. What you'll note is for next week, the number of unknown in the race category will go down, because as the data come in, those data do get backfilled. And we've all heard about it. We talked last week about some of the tremendous racial disparities that we've seen and who's gotten the vaccine in their arm. And probably the biggest problem that we had is a whole lot of missing data. And there is a movement afoot to get that problem solved, not just through goodwill, but through legislative effort. Geographically, we do still have some hotspots, but you'll notice there's a much more dispersed effect. The blue denotes where the sort of community spread is, and you'll see it's thinning out. It's thinning out even in the face of slight increases. So again, our goal is to do our part to turn the tides. All right, I won't spend much time on this. We heard about the Johnson & Johnson vaccine, slightly lower effectiveness rate. Well, not slightly lower effectiveness rate, but it still provides a strong degree of protection, 72% against COVID infection and severe illness. So again, if you have the chance to get the vaccine, and people say, well, which one should I get? I want to let people know most of the time you won't have an option. You will have to take the one that's available to you. But you've now heard from credible scientists, we say any one of them that's available to you will provide you a degree of protection, and the minor risks are far outweighed by the tremendous benefit. I'm going to hand it over to my colleague, Mary Catherine Crawford, who's going to talk about policy recommendations.
Thanks, everyone. So first and foremost, if you do have any questions upon receiving the brief, if you have anything you want to ask me about, just shoot me an email at crawf457@msu.edu. So I'm going to go ahead and just talk about our policy recommendations that we have this week. So we're calling on our legislators to protect the Michigan Department of Health and Human Services use of the Social Vulnerability Index. Is currently an amendment attached to COVID relief bills seek to bar its use, which would remove numerous social constructs that are essential for us to look at for equitable vaccine distribution. And secondly, as cases increase up 27% in the last week in the county, policymakers should be prepared to act quickly and within their legal authority to implement restrictions that are known to stop the spread of COVID. And lastly, we need our policymakers to continue to engage public health experts to mitigate inequitable distribution of the Johnson & Johnson vaccines to marginalized communities by monitoring distribution to identify any non-adherence to the CDC and state guidelines, and also intervene should those inequitable patterns be observed. And so for opportunities of how you can help with the pandemic response, to volunteer with the Genesee County Health Department, go to gchg.us/coronavirus and to see the volunteer sign up form. And we also encourage you to keep using the free My COVID Alert app, which will let you and others know if you've had any potential exposure, whether or not you know them or know that you have had it. So it's a really great tool. We recommend you use it. And then if you have any questions about the data that Dr. Verholden had run through in the beginning, please contact my fabulous colleague, Rick Sadler, SADLERR@msu.edu. Thanks.
Always doing her best work on mute, my partner.
Thank you so much, Dr. Berry. I'm just being mindful. I don't want to be talking while you're talking because I always say, yes, that's really good stuff. So thank you so much, Dr. Verholden and Mary Catherine for that information. So we're gonna again say to our panelists, if you would, make sure you hit that answer live button in the Q&A, and because the wonderful questions that are coming in today, we wanna make sure that we get them all answered for our participants today. We really had some more questions over the weeks about this open enrollment period. It is a special open enrollment period that President Biden allowed because of the short window we had during 2020. And so Jim Melanowski is back today to give us some really specific details on the open enrollment period and another really important event that's happening at the Genesee Health Plan. So Jim, welcome this afternoon, and give us that update.
Well, hi, Yvonne. Thank you. So if I could have the next slide. Yes, President Biden announced a second open enrollment period, and it's already started from February 15th to May 15th. And if you remember, probably not my previous talks in the fall, is that during that open enrollment period, it was only open from November 1st to December 15th. And that has been the way it had for the last few years. And many felt that it limited enrollment into the Affordable Care Act from compared to other previous numbers. And I'll show you those numbers here in Michigan in just a bit. One of the nuances that changed this time around, and it's a good thing, is that if someone chose a health plan in when they enrolled in November or December, and it's not working for them, or it's not just right, or maybe they found that it's too costly, or it doesn't cover their medications or their doctor, it kind of gives them a mulligan, if you want to use a golf term, and it allows them to make any changes that they change in their healthcare plan selection if they chose something in November, December that's not working. So that is really one of the key changes that I want to reinforce with people, so that people are not stuck with that. We always talk about everybody in Genesee County should have healthcare coverage. So Genesee Health Plan is available to assist people either virtually or over the phone, not only in Genesee County residents, but Saginaw and Bay County. If you know people in those communities, we can assist. And then we have colleagues that participate in this webinar and are good partners at the Genesee Greater Flint Health Coalition and Hamilton Community Health Network that are trained in this enrollment. These are certified enrollment specialists that know how to enroll people into different things. So again, if you're having a conversation with somebody and they tell you, I don't have health care, or I lost my health care coverage, have them contact us or one of those organizations and they can get health care coverage. Next slide, please. You can see, and when this first Obamacare or ACA first got enacted, there was a lot of response to this, and so you could see the spike, but now those numbers have decreased, and there are some reasons for that. There was a shorter enrollment period over the last 4 years. There wasn't as much media and dollars generated with that. And I think there's a lot of misperceptions about it, a lot of high costs to people early on and their renewals. So again, I think the staff that are available at these organizations can really help with that. We want to see those numbers increase. And then also people can enroll into Medicaid anytime during a year and Genesee Health Plan. So those are always open times for enrollment. I just don't want people to think that it's also limited during this time as well. And then, as you mentioned, Yvonne, we've had this now for a number of years, and we partner with Savita Credit Union. It's an essay contest about health heritage. We talked about Black History Month a couple of weeks ago, and really we created this contest in light of Black History Month, and so this is a contest that's open to all Genesee County students in elementary, grades 5 and 6, middle school, junior high, and high school. And what we really want people, students and their families, to do is talk to each other, to understand their family health history. So we start that at an early age with our children on what is our health history. And in a new twist to this contest is we want the families to talk about COVID-19 and the impact on their family and their friends. And then also the impact on social justice, health, and racial equity. We talk a lot about those areas, and I would love to see from a younger children perspective and a high schooler perspective, what do they see out there, and how race and equity impact health. So prizes are awarded in those 3 grade categories, and you can certainly learn more information at geneseehealthplan.org. And teachers can also get prizes if they really encourage their students to participate, and they have the most entries from their classroom. We'll give the teacher a prize. And I tell you, teachers have such limited resources for their classrooms. And so it's a wonderful opportunity for teachers to get a little bit of spending money that they can use for their classes or their classroom. And then we also, this is something that we've done for the last few years, is for high school seniors, some extra scholarship money for college. And if you've been a parent or are a parent of a high schooler or college student, every dollar counts out there. And so this is a contest for all Genesee County high school seniors planning to pursue a career in the healthcare, health-related science field. So why did they choose that field? Really talking about, again, how their family history might have impacted that decision. The picture that you see are the two winners from last year who did a wonderful job of describing why they chose their professions. Again, our website details that. And if I could have one more minute, March is Colorectal Cancer Awareness Month. And you're supposed to wear blue for that. And for once, I'm right on the color of what we're supposed to do here. Folks, if you're 45 and over, those guidelines and recommendations have changed. It used to be 50, but now they've lowered it to 45. Get a colonoscopy. It's not a lot of fun. I know, Yvonne, you've had one. I've had one. It's not the greatest process, but the colonoscopy does two things. It can detect that you have a colon cancer, or diagnose if you don't, but also it cleans up any of what we call polyps in your colon. They can take it out while they're doing the test. And it kind of kills two birds with one stone. And this is like one of the easier ones to treat if you get it in time. So you can remove those polyps. So I would encourage everybody in that age group and above to get their colonoscopy.
All right, so Jim Melanowski, you told us about the health plan, and now you're giving us another reason why we really want to focus in on this colorectal cancer. We talk about health equity, we talk about all of those challenges, but we do see a disparity in the number of African Americans or that also have some of these cancers because we weren't getting screened early enough. That expansion will help us hopefully improve upon that. So thank you for that insight today.
Yes, thank you. That's a really good point.
Yeah, and so all of the work that we're doing to really make sure, and this is Dr. Deborah's thing, she talking about mandate equity. We have to do some things differently in order to ensure that equity really happens. So as part of our work today, and just some announcements, we're going to talk of just a really quick, I'd like for Sherelle to come on and chat with me for a minute as we look at the testing sites. We are still, as Dr. Deborah gave us that information, we're still testing because testing is so very, very important. While we're talking about vaccine availability, it's still important that people get tested so that we can see where we are in terms of COVID positivity. And so we have our sites that have already been set up across the community. You can go on the Genesee County Health Department somewhere every day in our community. Test sites are available. Word of Life Church between Bethel United Methodist Church and Macedonia, you can get a test. There are also sites available across the county at various other sites like Hamilton Community Health Work, the Genesee County Health Department, and some of our pharmacies. So Sherelle was with us last week. We introduced her to our audience last week. So Sherelle, tell us a little bit about an insight about what's happening as it relates to vaccine availability and opportunities for getting those vaccines in our community.
Hello, everyone. So I am currently at a clinic right now. We are at Our Lady of Guadalupe Church, distributing vaccines for COVID-19 today. Every week, we're able to access more. You know, Johnson & Johnson was okay to pass on Friday, so we are expecting to receive Johnson & Johnson soon. So we'll have more vaccine on hand. We are doubling up our clinics and we are extending our hours. This week alone, we did 9 clinics in total, and our numbers are increasing every day. So if anyone needs to pre-register for an appointment, you can go to gchd.us or gc4me.com to become pre-registered. And since we have all of these extra sites popping up, we're able to get more people through.
Thank you, Sherelle, for that work that you're doing even right now, you're giving us live and in color. We're right there at Our Lady of Guadalupe. Thank you so much. So if you get that appointment, it's very important that you keep that appointment, be there 5 minutes early, and be prepared to stay a little bit longer to make sure everything's okay.
Yes, true. So after you receive the vaccine, we do observe for 15 minutes just to make sure that you don't have a initial reaction to the vaccine. If you've had reactions in the past, we do observe for about 30 minutes. So we are taking.
All right, so everybody, if you're interested, please tell your family, friends, neighbors to sign up on that register on the site so that when you get there, everything is in order. Thank you for joining us, Sherelle. We appreciate you.
No problem.
Yes, and so the three things that we want you to remember, Dr. Deborah talked about them earlier, and we want you to remember, we're going to remind you before we get off off the webinar today. But right now, our friend Afton Shavers from the Greater Flint Health Coalition, she's going to give us a little bit of insight on what happened with the recast, but she's also going to provide us some insights on these other initiatives that have also been supported by recast. Afton.
Hello. So first off, thanks to Jim Milanowski for wearing the right color today. I also have on the blue. So I know we missed it for the Wear Red Day, but we are both wearing our blue today. So we're right on the money. So quickly, I want to say that if anybody needs help or support with the enrollment for insurance, the Health Coalition can help you. And so you can contact us via phone or text at 810-853-6458. And I did put that in the chat, or you can email the coverage team at coverage@flint.org. And so what's also on your screen is the list of trainings that are available via Flint Recast and Genesee Health System. Throughout the community. So there's about 93 different opportunities for people to get free access to mental health training and support. And so to get any of those signed up for any of those activities, all you need to do is go to genhs.org and you can get the information and you can sign up right there online. And then also we have our Coffee and Conversation series. So this is the fourth Wednesday of each month at 3 p.m. And this is for Flint parents to kind of talk about what's happening in your life in response to COVID and parenting. How are you managing your work life, your school life, teaching 3rd, 6th, 7th grade, virtually or also / in person now. You can sign up for those using the Eventbrite link there, or we also have the number for the meeting ID that will be available on the Recast Facebook page as well. So it's a Zoom invitation, and so you can do that. And then last but not least, we definitely want to share that we have some opportunities out to support some temporary workers. So this is a combination partnership between the Health Coalition, our Flint Employment Opportunities Program, GST Michigan Works, and our health department. And so these are temporary part-time positions for folks that can help do some of the support for those vaccinations, for the COVID testing, also to do some of the clerical support that we need for our health department, sort of in response to disaster and recovery. And so these positions are going to pay actually a pretty decent wage at $16 an hour. They are temporary positions. They can be full-time or part-time temporary, up to 40 hours a week. And so the anticipation is that these positions will last about 6 months. They're really designed for residents who are unemployed or underemployed in the response to COVID-19. You do need to be a resident of Genesee County. You do have to have a high school diploma or a GED, and you can apply for these positions by visiting the Health Coalition's website at gfhc.org. And so once again, these positions are for the health department, and the folks that will be hired will be working under the tutelage of the health department team. And that's all I got, I think, today, Yvonne.
Right on the money. Thank you so much. And money, because these jobs are offering money. We want to remind you, please follow the 3 W's that we encourage you every week. Wear a mask, wash your hands, and pay attention. Watch your distance, watch that density, as Dr. Reynolds talked about, how many people are around you. If it gets too thick, then you know that you take that step to remove yourself so that you're safe. We want to also encourage you, if you're a community health worker, the CEUs are available for you. Please register for them. And we're excited to be able to say we're just ready now for our social work credits to be available to as well. We're in the final stages of that, so stay tuned. And next week we should be have all that information up to you. I want to encourage you, like us on Facebook and subscribe to our Healthy Flint YouTube channel. Email us any questions that you might have at info@hfrcc.org. And of course, you can give us a call at 810-835-2130. I know it's a lot of information that we've shared with you today. Our panelists are behind the scenes still answering questions for you. And so continue to look at those answers. And I want you to really think about it. Next week is going to be another great week. It will be week 52 of these webinars. And we've got some important information that we will share with you. So we thank you again for joining us today, and we will see you next week.